Are you wondering what chronic pain truly is? Have you been told time and time again that all of your labs and images are normal, so that there's just no explanation for your chronic pain? If so, you're in the right place. In this video, I'm going to simply break down what chronic pain is and why it persists even though all of your labs and images are normal. So by the end of the video, you will have a better understanding so that you can be a better self-advocate for yourself and have more realistic expectations for your chronic pain treatments. If you're looking to get out of chronic pain, one of the most valuable tools that you can have is the knowledge of what chronic pain truly is. Now, this is a very complicated topic that's very individualized, so we're not going to go anywhere near that complexity. But just having the basic understanding of what it is going to help you be a better advocate for yourself because let's face it, you have to be the one pushing for doctors to run new tests or try new therapies. But it's also going to help you have better expectations of what new therapies should do and what results should look like. So let's get started. First and foremost, chronic pain is a message that something is wrong, that something somewhere is not quite right, and your body is going to get your attention about it. Now, while this is incredibly unfair, use it to your advantage because at the end of the day, when you're feeling down or defeated because your treatment options aren't working, or your doctor may even told you that this is something you're going to have to learn to live with, know that as long as you have pain, it's because something or usually multiple things are still not being addressed or properly treated. Now, secondly, pain is a symptom, just like a cough. And it serves two purposes. One, to tell you where the problem is at. So in this case, respiratory. And it is part of the solution. Coughing helps expel the pathogen causing your issues. But keep in mind that we don't treat symptoms, right? As long as you're treating your pain, you're missing all the things that are causing the pain, and this vicious cycle is just going to continue. Now, there's a big difference between acute pain and chronic pain, and you need to understand this in order to have proper expectations for your treatment options. So, acute pain, say you stubbed your toe hurts. That tells your brain where to send all the nutrients and also reminds you, hey, maybe we need to baby this foot a little bit, not put so much pressure on it. Watch out for that coffee table, this and that. And once the tissue has healed, the pain goes away. That's how pain is supposed to work. But with chronic pain, the pain persists long after all the tissues have been healed. So just because your pain feels physical does not mean it is always coming from a physical cause. There are biochemical and emotional contributors to chronic pain that often go unaddressed. So as long as your doctor is trying to treat your pain physically, they may be missing all the other causes. One of the most frustrating parts of having chronic pain has to be being told that all of your labs and tests are normal. So, if that's the case, why does your pain persist? Well, let's break it down. It's important to remember that chronic pain is not a disease. It is not something that you contracted out of the air one day. It is a dysfunction that has been developing over time, consistently incorporating new organs and systems into the picture. So if your labs and images keep coming back normal, you have to ask yourself, were they just too basic? Right? All of our standard labs and images are equipped to look for diseases, not dysfunctions. Advanced laboratory tests are looking at organ systems as a whole and help you find where the breakdown is at. We have many studies across all chronic pain conditions that prove physical abnormalities do not equate to pain. So this means on an MRI, someone could have a massive disc herniation and yet have no pain. Or vice versa, someone can be in excruciating pain, but all of their images keep coming back showing no physical abnormalities. And the reason being is that pain, while it feels physical, is not just a physical problem. It is a biochemical problem and an emotional problem. And these things are much more difficult to test for if they're even being tested for. So this is why advanced laboratory testing can make the difference between living with chronic pain and being free of it.